Today I will present the preclinical activity of UCARTCS1 in multiple myeloma patients. So this far, CAR T cells have been promising in multiple myeloma. However, BCMA CAR T cells are mostly, the production is timely and costly. And most relapses are BCMA low. So this indicates there is a need for alternatives. And UCARTCS1 might be a good alternative. These allogeneic CAR T cells are knockout for the TCR alpha chain and for CS1 to prevent fratricide and graft versus host disease. And we tested these CAR T cells in multiple myeloma cell lines and multiple myeloma bone marrow samples from 30 patients. And in the cell lines, we see that these UCARTCS1 are effective in cell lines with a high and a low SLAMF7 or CS1 expression. And in the patient samples, we tested 30 patient samples, so 10 newly diagnosed, 10 relapse refractory, and 10 DARA refractory patient samples. And there is a dose-dependent and CAR-mediated lysis of the plasma cells in these samples. And there's no difference between these three patient subgroups. UCARTCS1 also target non-malignant hematopoietic cells such as CD4 T cells or NK cells, B cells. However, the lysis of these cells is less pronounced because of the low SLAMF7 or CS1 expression on these cells. Besides, we did see that there was no impact of tumor burden or CS1 expression or a number of Tregs on cell lysis when testing UCARTCS1. So at last we tested UCARTCS1 in a mouse model, and also in this in vivo experiment, UCARTCS1 has a very nice lysis of the myeloma cells compared to the control T cells. So in conclusion, these UCARTCS1 cells are effective in newly diagnosed and heavily pretreated multiple myeloma patients, and this underscores the importance of UCARTCS1 in the ongoing phase 1 trial.